Doug and Christine here from KCI CrossFit, running you through our hip mobility assessment today. To begin, I'm going to have Doug get on the floor in a comfortable lying position, face up. After that, I'll have him decide on which leg he wants to do first, but one leg will remain straight on the floor. The other leg, he is going to bend at the knee and try and use his hands to bring that knee up and into the body. So he'll lift and kind of pull that leg in. What I'm looking for in this assessment is how close is his knee getting towards his body, and can he keep his opposing leg mostly straight? Is he straining? Is he experiencing any pain? Can he pull in any more? Or do we need to release and let go here, okay? Good. So this will be our hip flexion assessment, and I want him to score each leg separately. So let's go ahead and do that other leg and see how that one scores. Does that feel about the same?
Mm-hmm.
Okay, good.
It's more about my thighs hitting my cavity.
Good. Okay, so moving on from our hip flexion assessment, we'll move into our hip extension and glute recruitment assessment. For this one, I'm going to have him come up and get into a position where he can take his body down on top of one of his legs while the other leg remains straight. After that, I want him to find a comfortable position on his forearms. So he'll come down onto his forearms. And then he is going to try and lift the back leg and hold it with control. So he's going to lift and hold, and we'll see how that extension and glute recruitment is. Good, relax. Good, now what I want you to note on the next couple reps that he does is he leaning forward excessively to make that happen, or does he have to bend excessively to make that happen, okay? So we're gonna say that good hip extension and glute recruitment would be that he can lift and hold that straight leg with control. And we'll again score each leg separately. So let's go ahead and flip around the other way so that, yep, there we go. Yeah, good. So there's our assessment for hip extension and glute recruitment. After that, we'll move into external rotation, and I'll have him get into a straddle position to start, and then bringing one leg in close to the body here. The outside part of the ankle for that straight leg, he is going to try and get onto his opposing thigh. And this is going to be a good challenge, and this is for our hip external rotation. So if you're noticing at home, like we're experiencing here, that there's a challenge getting that foot on to the opposing thigh, that's okay. Go ahead and lay off just a little bit, and still note the distance between the thigh and the foot here, okay? We're gonna want something that's about 5 centimeters or below. So I'll demonstrate that where I can get into that position and I can gently press down and decrease that distance between the thigh and the foot, and I can move forward without pain there, okay? So eventually, we want to be able to try and get in that, and again, yep, scoring both sides separately and noting those differences between one side and the other. Can we get that ankle to the thigh? Is there a big gap here? Can he, with a little bit of pressure, gently push that down and decrease that distance between the thigh and the foot, okay? Good. For our final hip assessment, we're going to move into internal rotation, and he'll get into an all-fours position. I'd like him to have his knees underneath of his hips and his hands underneath of his shoulders, and I'll have you come around here. What I want him to do is keep his hips neutral, keep his knee as his pivot point, and then I'll ask him to move his foot out here. Okay, so he's just gonna move his foot out. So did you see the shift in the hips there? So let's try it again while keeping awareness to the hips. Good. I'd like him to have a greater than 15-degree range of motion here, and score each leg separately. So good, I can see he's focusing on trying to keep the hips level and keep that knee as his pivot point, and then we're gonna move that foot out and away from the body, okay? Again, about a 15-degree or greater range of motion there. Again, these are something that are simple and can be done at home without the use of equipment. Once you go through our hip mobility assessment tests like we've just done, we encourage you to try our hip mobility exercise routine and then give each of these a retest and see